Hello and welcome to the SMP Senior Medicare Patrol podcast, Sip and Learn with SMP. Thank you for joining us today. I am Janetta with Senior Medicare Patrol. I am the Community Outreach Specialist for the Mississippi area. We also cover the state of Georgia. So today, our topic for today, we're going to talk about DME fraud and also give you information about the Senior Medicare Patrol program.
And I'm Brenda. I'm the Community Outreach Specialist for Louisiana. And before we get started, I must say that this project is supported by a grant from the U.S. Administration for Community Living, Department of Health and Human Services, Washington, D.C. 20201. SMP is sponsored in Georgia, Louisiana, and Mississippi by AdviseWell, Inc. So today we are going to talk about durable medical equipment, or DME. So Janetta, can you explain to us what is DME? What is durable medical equipment?
Sure, Brenda, that's a great question. Durable medical equipment, or DME, is medical equipment that is prescribed by your doctor that is reusable. It includes things like back brace or knee brace, hospital beds, walkers, wheelchairs, scooters, and any type of prosthetics. Medicare only covers DME if you get it from a supplier that is enrolled in the Medicare program. And Medicare only covers 80% of their approved amount for any of these items. So Brenda, tell us, what is DME fraud? And give us some examples of DME fraud.
Okay, well, some examples are, for example, suppliers who offer free equipment but bill Medicare, suppliers who want to use their doctors but not yours, who then prescribe unnecessary medical equipment. Also, suppliers or doctors who provide medical equipment or supplies that you've never requested. Suppliers or doctors who charge for items that you never receive. Also, suppliers who bill for people who have passed away. Suppliers who request your Medicare number at a presentation, during a sales pitch, or during an unsolicited phone call.
Yes.
They do that a lot. Beneficiaries who willingly allow their Medicare number to be used in exchange for money or gifts or unnecessary equipment and supplies. Also, suppliers who deliver an off-the-shelf product but bill Medicare for more costly product. And these are, with these examples of fraud, these are the ones that we say you have to be very aware of. They're, in some cases, they're very, very obvious. In other cases, they're very subtle, but you should always question something you don't feel comfortable with and trust your gut. So beware of those phone calls that you get from people saying that they represent Medicare and they're trying to sell you products. Remember, Medicare will never call you. So right there, that's a red flag. Also, be very wary and careful of television and radio ads that run targeting beneficiaries to get them to, for you to get you to order these free DME items. These ads don't have your best interests in mind, so don't fall for this false advertising.
Right.
Also, some aggressive marketing. Don't let people pressure you into switching your suppliers if you already have a supplier for for supplies that you do need. Don't let them convince you that you need to switch, or don't allow them to intimidate you.
Right.
Okay. Seniors and Medicare beneficiaries across the United States are receiving calls from people offering them free back braces and knee braces. We know this because people tell us that they're getting these calls on a daily basis and they're very tired of it. Yes. They also ask the beneficiaries for their Medicare number, the date of birth, and other personal information. Remember, never give out personal information. And then in some cases, the equipment is never received, but Medicare was billed anyway. Okay.
Yeah.
Sometimes the equipment is received, but it doesn't fit right. So you're not able to use it. And then after trying to use it, you can't return it. So those are all the examples of some of the frauds and the scams that are going on and the way they trick you into believing that you're getting this from your doctor, but you're really not.
Right.
Another big one is wheelchair scams. These TV commercials offering these items at little or no cost to you. Please be aware of this. The Medicare rules stipulate that you must have a legitimate need before getting a wheelchair or any other item. Okay,
Yep.
so also a certificate of medical necessity must be signed by your physician before you can get these items. So if you think you've been a victim, that's where SMP steps in, Senior Medicare Patrol, and you can call us toll free at 877-272-8720 from 8:30 in the morning to 5 p.m. Central Time, and you can let us know what your concern is. We also have a website that you can visit, and that website is stopmedicarefraud.org. So if you have any concerns or questions, you feel free to call us. We are a free resource to you, Senior Medicare Patrol. And remember, we particularly cover Louisiana, Georgia, and Mississippi. So again, our number 877-272-8720. So Janetta, what can you do to avoid becoming a victim of one of these DME scams? What can beneficiaries do?
Great question. The best way to avoid becoming a victim of DME fraud and scams is to protect your personal information. And that's the best way to do from any scam, protect yourself from any scam, is to protect that personal information. Never, ever give out your Medicare number to a stranger, whether that be in person or over the phone. We ask that our Medicare beneficiaries to treat their Medicare card as if it were a credit card. You're not giving your credit card to people that you don't know and giving out that number randomly. We ask you to do the same for that Medicare card. Refuse and report anyone offering free, and I'm going to say that free equipment is always free, or supplies or services in exchange for your Medicare number. If you mistakenly give out your information, if you give that information out by accident, we ask for you to review your Medicare Summary Notice, MSN, or your Explanation of Benefits, EOB. And that is the best way to make sure no one is using your Medicare number. If you see any suspicious items on those Medicare statements, you should report it. It's very important that you care about what's going on with your Medicare benefits. Remember, if Medicare pays for equipment that you never ordered or never received, and one day you may need that equipment, Medicare could deny it and say, well, we've already purchased that equipment for you. Because it is showing that you already have it, then they're not going to pay for it again.
Right.
Senior Medicare Patrol is available if you have questions. Again, our toll-free number is 877-272-8720, Monday through Friday, 8:30 to 5 Central Time. We also have that website that Brenda mentioned. It is www.stopmedicarefraud.org. So Brenda, tell us, how can you report DME fraud? What steps do you take to do that?
Okay. Well, you can report DME fraud by calling us at SMP at 877-272-8720, again, from 8:30 in the morning to 5 p.m. Central Time. And I must say that when you call, you will get a live person, and people really like that because they don't have to go through this computer or pressing buttons. But then again, if you do call and it's after 5 p.m. or on the weekend, you will get our answering machine. You just leave a message and you will get a call the next business day.
Yes.
Okay. You can also contact us through our website at www.stopmedicarefraud.org. And if you do notice something on your billing statement or your Medicare summary notice or your explanation of benefits, any suspicious charges, something that you know you didn't ask for and still you're being billed for, give us a call. And we will look into it, obviously with your consent, and try to get answers to your questions regarding that particular issue. Also, if you're listening in any other state besides the three that I've mentioned, Louisiana, Mississippi, and Georgia, there is an SMP in your area, and you can call 877-808-2468. Let them know what state you're living in, and they will connect you to your local SMP. They will do the same for you if you call them and question something on your billing statement. That's the resource center. That's the number I gave you for the resource center, which is the smpresource.org website. You can also go there if you don't want to call to get the contact information for your local SMP. We're a national program. So in order to not to become a victim of frauds or scams, remember those three keys: protect, detect, and report.
Okay.
Do you want to talk to us about the three keys?
Sure.
Okay.
So as Brenda said, we have three keys that we like to always tell our beneficiaries about. And the first key is protect. We ask our beneficiaries to don't give out the Medicare number to anyone. This includes on the phone, at a community event, health fair, for free screenings. Medicare will not call you and ask you for personal information. The next one is detect. Review your Medicare summary notice and your explanation of benefits. Look for charges on services that you didn't receive. Also, look for charges on items that you didn't request. Look for things not ordered by your physician. The last one is report. If you notice something strange or unusual on your billing statement or that'll be your MSN or explanation of benefits, you should report it. You can report DME fraud by calling that toll-free number 877-272-8720, Monday through Friday, 8:30 to 5 Central Time. Or you can contact us on our website, www.stopmedicarefraud.org. And remember, reporting protects the Medicare program and Medicare benefits that from increased cost. And it helps protect others from becoming a victim. And we like to say together, we can fight Medicare fraud.
Correct. It's a $60 to $100 billion problem that we suffer every year from money coming out of the Medicare program for the wrong reasons. This money's falling into the hands of the scammers, and that's something we need to try to avoid. I know that we probably won't be able to stop the fraud completely, but if we can put a dent in it, then that will help. And you're our eyes and ears in the community if you see or know of anything that you may want to report so that we can go in and investigate. But DME, durable medical equipment scams and fraud, that's a huge problem. And that's just something that you might be able to become more aware of so that if you see or hear anything, you can report it. So I also want to mention that for listening to today's podcast or for watching it, because we're also on YouTube, you can call in and get a My Health Care Tracker for free, just for listening. You can call our number at 877-272-8720 and request it. Let them know that you watched the podcast or you heard the podcast and that you're interested in getting your own healthcare tracker. It's a little booklet that will help you keep track of all your doctor's visits so that when you do get that explanation of benefits or summary notice, Medicare summary notice, you can compare your visits to your summary statements. And that way you can detect anything that isn't supposed to be there and call it in and report it. So again, if you want your free healthcare tracker, 877-272-8720. If you had someone watching with you, you can order one for them too. It's free. It's a gift from SMP, and also explanation of who we are is in this booklet too, in case you have any questions. But again, this is what we do. Our work as community outreach specialists is to help you and empower you so you don't become a victim of Medicare fraud and healthcare scams. Yeah.
Okay, Brenda. Well, thank you so much for joining us and tuning into this episode. Yes. We hope you join us again for the next podcast, Sip and Learn with the SMP, and for more SMP content and information on these new topics. All right. Thank you, Brenda. Yes.
Well, thank you. And thanks everybody for joining us, and we'll see you soon.
All right.